All right, good morning, you guys, and welcome back out live on our patio with Dr. Mark Casanova. We've been chatting about obviously back to school and COVID-19, and we will continue to talk about that, but I want to kind of pivot the focus of the discussion on Governor Greg Abbott sending a letter to the Texas Hospital Association saying, hey, you guys, we need to put a pause on elective surgeries for now. Can you explain why he would do that at this point?
Well, there's two reasons that hospitals would pause elective surgeries. First is to reduce the occupancy in the hospital. Something might be elective, but it could still land a person in the hospital overnight, or if there's complications, for several days. So on one level, it's to reduce bed capacity in the hospital, or increase bed capacity, if you will.
Yeah.
The other reason is potentially free up staff. Free up nurses and physicians to serve in other capacities in the hospital.
So what would be okay? You know, I'm thinking of elective procedures for people. I mean, colonoscopies, screenings, any sort of outpatient procedure that you already have scheduled.
Right. So there's those things. There may be the pre-planned orthoscopic procedure that somebody might be able to forestall for a little while. What we do want people to understand is that if they are acutely ill, if there is an urgent medical need, those procedures still need to happen. They still need to present to our hospitals and places of care to have that addressed. So these are really, we sometimes refer to them as non-emergent procedures, not just necessarily all elective, because that doesn't capture the full scope of what it is we're talking about. I think it's also important to understand that our hospitals over the last number of months have been quite busy. Part of that has been catch-up care from last year. So we want to really balance this and thread the needle as best as possible. We don't want individuals forestalling procedures if these procedures are diagnostic and they've had an initial abnormal finding. So a biopsy that needs to be followed up on, a colonoscopy for an abnormal finding. These things still need to be discussed with their physician and decided when and how do we proceed with these.
You know, I'm glad you mentioned staffing, because I've talked to friends and people I know at pretty much every hospital here locally who've said we're exhausted, we're short-staffed, and frankly, it feels like deja vu, right? You know, they're sort of still traumatized from the waves of people who were coming in with COVID, especially last year, and they feel like, you know, they're kind of bracing for that same thing right now. I've even read that for one COVID patient, that means 23 hospital members, staff, you know, respiratory therapists, all these people are tending to one patient. And so when you say freeing up staff, I mean, that is the truth.
Right. It's not just all about the bed and an empty room in a hospital. It's, do you have the staff for that bed? Just yesterday, at the end of the business day, we had 14 staffed ICU beds for adults in Dallas County. That is an ominous number. Our pediatric hospitals currently are running at approximately 94% capacity.
The pediatric hospitals.
Pediatric hospitals.
Okay. Let's continue this conversation on I Am Still Up. That'll be on the Daybreak Facebook page. You can bring your questions there as well. Dr. Casanova is going to kindly stick around for a few more minutes. For now, we're going to send things back into Greg.